or not really?
I am recording. Yes.
Oh, you are? Okay. I thought, okay. So for our tip of the leak of the week, as John mentioned, maybe we should change the name, right? So let's bust the myth here. And for years, we've been told never give black cohosh to women with estrogen receptor positive breast cancer. But that's for me. That's how was I believed it. But what if I told you the science says the opposite? Black cohosh isn't a phytoestrogen. It doesn't bind estrogen receptors. Instead, it works like a neurotransmitter ninja, modulating dopamine, serotonin, GABA, and opioid pathways that control thermoregulation. Translation: he claims it calms hot flashes without making up, I guess, estrogen problems for us, meaning not making up estrogen receptors. So here are two key trials that we have. So tamoxifen plus black cohosh in 136 women with ER positive breast cancer. So ER positive, after 12 months, half of those on black cohosh were completely free of hot flashes. Compare with the controls where most were still sweating through their sheets. Zero serious side effects. Another study, hormone suppression trial, was 85 women for 12 weeks. Black cohosh improved symptoms with no changes in estradiol, LH, FSH, or uterine lining thickness. So it works and it's very safe. So the protective twist here is the plot twist is black cohosh might actually protect against breast cancer. A case control study of 2,500 women found a 50% lower breast cancer risk among users of black cohosh. And a survivor study, recurrence was delayed from 2 years in the control group to 6.5 years in the black cohosh group. So that's just not safe. That's pretty impressive. So preclinical data even showed anti-proliferative effects on breast cancer cells. So maybe this herb isn't the villain. Maybe it's the underdog superhero with a botanical cape. So take home message here. So black cohosh is safe, effective, and possibly protective in breast cancer survivors. So what's the dose? 20 to 40 milligrams standard extract daily. It's safe with tamoxifen, and also routine monitoring should be done, of course, in any type of conditions. So instead of avoiding it out of fear, let's use it smartly. Just remember to loop in the oncologist because nothing ruins your day like an angry phone call from him, right? So from misunderstood villain to potential superhero, hot flashes down, quality of life up. That's a win-win, worth sharing to all of you guys today. So that's our annual tip of the week.
Well, are you sure that the breast protection isn't from the tamoxifen? I mean, that's
Well, that they yeah, so they kind of randomized it also
yeah.
that
Not,
there's a control group not taking the tamoxifen.
I mean, I'm.
So that's why,
Oh, okay.
I mean, yeah,
I'm,
um, uh,
I can
that's kind of
only
like
I can only speak for myself, but I don't know that I've ever used tamoxifen with when somebody comes in and they want herbal remedies for hot flashes. I never added tamoxifen to it.
well, tamoxifen is basically being used in that ER positive breast cancer study. And of course, they're having hot flashes at the same time because that's one of the side effects of tamoxifen. And
Mm-hmm.
black cohosh was used to negate that. So they're worried about, of course, they don't want to use anything estrogen. We use estrogen to remedy hot flashes, right? So instead, black cohosh was chosen to actually remedy this. And it didn't aggravate the ER positive breast cancers.
Okay. So we've used other combos of of course chaseberry we've used with black cohosh, and I've used
Mhm.
a black walnut seed with black cohosh, and we've used Swedish bee pollen. So we've used all sorts of combinations. So I was about to introduce Dr. Gerber, our speaker, and he he waved and went off. So um,
There's a medicine that I think it's Veoza. It's
yeah,
a
yeah,
basically an
yeah.
antidepressant,
The
right?
drug
An
rep
unhormonal.
Yeah, the drug rep actually showed up here at my office today. I think this is the second time in 13 years I've had a real medical doctor drug rep show up. The only other ones who show up are the NP thyroid people. So,
Right. So it's an antidepressant. It's an unhormonal therapy medication without estrogen to remedy hot flashes. So I haven't tried it. I don't know. Do you have experience with it?
no, so um,
Yeah, worth looking at.
anybody out there have any experience with that? Bioza?
Fezolinetant. That's what it's called, I think.
Yeah. Okay. Anyway,
I'm sorry, do you mind to repeat? What is limited?
VEOZ,
Vioza.
Oh, sorry.
VEOZH, I think it's spelled. Yeah, it's a non-hormonal. It's for vasomotor symptoms.
Breast cancer.
It's probably covered by insurance too. So
Yeah, it probably costs $800 a month.
If
yeah.
I have breast cancer, I will do.
We've used I can't get it.
I would fix the microbiome
I can't get
first.
it in the office. We've used Relazin, which is made by a company called Bonafide, which is Swedish bee pollen. That seems to work really well. And for hot flashes, we've used myochiro-inositol. That seems to work well, especially in the perimenopausal period. It'll actually straighten the periods out if they still have ovarian function. So,
Hmm.
it's not medical doctor stuff. So like when I went to the Androgen Society, they didn't want to hear about anything like, black cohosh or maca, to raise testosterone levels. They only wanted medical doctor stuff. So
The audacity.
yeah, I know. Right. That was I got to meet Mr. Big himself there. I was on the same stage with Abraham Morgenthaler. So
Oh, right.
the only
He's the president, right?
yeah, he's he was Mr. Big. He's the one who determined that prostate cancer did not come from testosterone when you're old like us. So um so Dr. Neri, you want just 2 more minutes? You want to a brief? We're finally getting our act together here, and we're
Oh yeah. Our conference?
yeah.
Yeah, so we are piling up the speakers already. I got some speakers. I got around 7 of them, and I'm sure we're gonna get some more. So
Dr.
we're basically eyeing the element here in Reno, and definitely we're gonna be trying to get some rooms locked up for somebody who's from out of state, so they can actually have the place to stay, and they will give us discounts for that. I think they're okay with around 10 to 15. I spoke to them today because
Okay.
you were asking around that level, right? Not higher.
Yeah. So
So it's mhm.
yeah, so we'll put together a nice program, Dr. Gerber. We'll get in touch with you with your folks, Dr. Quinn, with the research people. We will do a online. So it's holiday time and whatnot. If you can't make it, we couldn't get Sunday. So every place we went was booked on Sunday. So we have Thursday, Friday, and Saturday. We have booked December 4th to the 6th. We will be pursuing CME credits. We'll do that. And those of you who've been to my conferences that I run, we always have some nice surprise things to do at night after hours. So it makes you interact with each other. So, and if I can't get any of the good stuff, you'll get me to. I'm going to teach you how to do either rumba or tango. You're going to have a tango lesson. So, so and
You're
if it
gonna be
gets
putting them on
really
a
bad,
ghost hunt.
gets really bad, we're gonna have a karaoke contest. We'll have Dr. Fong run that. So and with that, I have to apologize because I got the Michael and I kind of got crossed up a little bit this week, and I got it all wrong. So you see the title of what he's going to be speaking about tonight there on the screen. So Dr. Michael Gerber is an institution in the Reno area. He graduated from Kansas City University School of Medicine, probably
What is
the year it was founded in 1972, I think, way back when. He did his internal medicine residency at Oakland County Hospital with additional training in Zaire, Africa, and he trained in psychiatric externship at the Crisis Intervention Ward at the UCSF Medical School. He's performed psychopharmacology research at Stanford Research Ward at Palo Alto, California Veterans Administration and Menlo Park Veterans Administration. He's always been drawn to natural approaches to medicine. Early in his practice, he studied with many well-known medical pioneers such as Dr. John Christopher and Dr. Pavo Areola. I hope I said that right. And two-time Nobel Prize laureate Dr. Linus Pauling. He's been a chelating physician since 1976 a diplomat of the American Board of Chelation Therapy in 1984, and a diplomat of the International College of Anti-Aging Medicine, a graduate of the UCLA Medical Acupuncture Training Program, president of the Nevada Homeopathic and Integrative Medical Association, past president of the Orthomolecular Medical Society, medical advisor, and featured columnist in the alternative magazine, The Townsend Letter. Personally, when I came to Reno, Michael welcomed me with open arms. He actually took one of my first year here, took one of my articles and had it published in the Townsend Journal. I learned how to do bibliography then, because I guess I had it all wrong back then. And Michael's been a great friend, a great resource. Anything in the integrative medicine world, Michael is like a font of, he's an encyclopedia. The only comparable person that I think I've run into that knowledge is probably Dr. Tano. So the two of them, we should have them on stage together. It would be a fascinating debate. So I know you're out there, Dr. Tano. I hope you're up for that. So with that, I welcome the premier integrative medicine practitioner in our area is Dr. Michael Gerber. So, and I know you're computerly challenged, so I hope somebody's behind you there in case things get dicey there. So take it away, Michael.
All right. Thank you, Dr. Clearfield. Very sweet remarks. I appreciate it very much. And according to your wishes a while back, I am going to speak a bit about EAV, electroacupuncture by Vol, and the new computerized versions of it, and the miracles that it bestows on us. So we'll get to that. My title, as you see, is Unsuspected Parasitism and Infectious Diseases. And we'll kind of go a little bit to the roots of some of those things. But as all of our patients come see us, and again, we're usually not the first doctor that patients come see, unless they're very oriented to healthy medicine. But we see the patients that have been to 15 or 32 doctors in various universities and have mysterious symptoms or chronic illnesses that have been treated and have been unresponsive or not changing and become more and more chronic, or just your average person with extreme fatigue and chronic pain and anxiety and depression and insomnia and overweight and very basic human problems. So with that, we'll kind of start through and talk a little bit about these guys. Well, there on the right side of your screen is an old pic of Dr. Reinhold Bohl, and he started this out in the early 1950s in Germany. And he made his Dermatron, which is not in this pic, but a first machine for testing in the 1960s. So this has been around a long time. So it works on the body's own external oscillation frequencies, and it's based on a combination of traditional Chinese acupuncture and electronic homeopathy. Testing is usually done on acupuncture endpoints, usually on fingers and toes, but you can use knuckles, you can use anywhere. So I've been using this technology for 30 plus years, and always in combination with standard labs. And so this modern computerized EAV devices store over 40,000 virtual images for testing. Well, homeopathy is certainly an art and a science, but EAV computers make it a little bit easier. There are hundreds and hundreds of homeopathic remedies on the hard drive of my computer. And, I use Murphy's Materia Medica and clinical repertoire, of course, to get close to the remedy of the patient. But I remember this last couple of weeks seeing a 7-year-old boy, fear of abandonment, trying to escape and being very mean and angry to his mother and his grandmother, kind of abandoned by his father. But on the other days, he was a cherub, just delightful child, very bright and very sweet. And he did have dreams of death and of the afterlife. So I thought, well, this could be, a number of things. But I looked at anacardium, which is kind of without a heart, but it has an angel on one shoulder and a devil on the other. And then, so I asked that about the computer, and the computer, it didn't weaken the patient. So I'm always, homeopathics are, frequently poisons, and they weaken people to my testing. And then I looked at arsenicum album, which is also angry and vociferous and actually has dreams of death. And the computer liked arsenicum. And we used, a lot of arsalb in general. And it's, for arse holes, some people say. But so then I asked the computer, would this child like a 6C? And in homeopathy, we dilute by Roman numeral X powers 10, C, 100, M, 1000, LM, 50,000. And so I checked 6C, and it balanced. So now if it didn't balance, I would have checked a 12C or a 30C or a 200C or a 1M. Not often 10Ms, but I do like LM frequencies, which are stronger and weaker. So I use a lot of LMs. But it does help to determine the correct homeopathic remedy and correct many things, and then you can get the correct dilution of the remedy, and then the blessed computer will make the remedy for you. If you put a tincture with about 15% alcohol, I use vodka, usually blue ice, which is made from potato rather than grain, and about 50, and with good pure distilled water. And you can put that on the plate and have the computer energize it for 2 to 4 minutes. And then you succuss it, you tap it on the tabletop 30 times or 20 times to enliven the energy of it. And lo and behold, you've got a homeopathic remedy. And so we can do this for hundreds of remedies and other substances. So it's a very handy thing to have around the office. And I'll mention more about brand names and stuff after the CME part of the show is over. So, and getting back to parasites and infectious diseases and viruses and bacteria and fungi and mycotoxins. So many parasites are extremely difficult to find and to quantitate. And we'll be talking about my very favorite guy, Phaseolopsis musci, the giant intestinal human fluke, here in just a few minutes. And I'll show you a nice picture of that gorgeous fluke. So we'll show you the different viruses that we look at, a few of the bacteria that are not as common, and you can differentiate between strep and staph and many mycotoxins. So you can differentiate between many different kinds of bacterial and fungi and mycotoxins on the EAV computer. Now, another area that we've touched on here is the problem of chronic dental infection. And as you may have remembered, the German biological dentist called root canals a corpse in the attic. The tooth is dead, can't defend itself, and they auger out the arteries and the veins and the lymph and the nerves. So the tooth is defenseless, and mouth bacterial organisms can take over, and it can become a nidus for infection. And I didn't put one in, but I'm sure many of you have seen a copy of the German biological dental tooth chart. And the teeth are all related to distant parts of the body by acupuncture meridians. So when something goes awry in the body and it's not obvious, and the labs are normal, and the physical exam is normal, and radiology is normal, it's frequently bad teeth. So with the computer, I can ask if there is the presence of a chronic bacterial jaw osteitis, chronic bacterial jaw infection. And if it says yes, then I can go around, or I can ask for acute bacterial jaw osteitis and go around to all of the teeth, or more conveniently, have the patient ask his dental secretary, what are the teeth that are root canal, and can test the teeth and see if they weaken him
Mike,
or her.
I don't mean to interrupt.
Yes, sir.
Are you moving your slides? Because they're not moving.
No, I'm just still talking about my first one here,
Okay.
hopefully. About halfway down. And I will go through the rest of them, of course. So then also for our very allergic people, they have to be careful about dental materials. And then the dental materials are on the computer, or you can have a whole stack of dental materials, as I do, to test them individually. Well, pharmaceuticals. Being an old Mr. Natural guy, I have tended toward a little bit more pharmaceutical use, especially in antiparasitical, antifungal uses. But in even a regular pharmaceutical, somebody says, my doctor put me on a diuretic, and I don't feel very good with the one he gave me. So all the pharmaceutical drugs are also on the computer. So I can ask, is furosemide, Lasix, the best one, or is hydrochlorothiazide better? And I can get a reading from the computer about what balances a person's energy better. And we balance every substance that we give the patients, vitamins, herbs, homeopathics. We check everything energetically to make sure it agrees with the patient. And we do see the most horribly, chronically ill people with, multiple allergic symptoms. And it also has habit drugs on there. And that's kind of interesting lately, using nicotine patches for COVID and other things, so you can check a nicotine patch right on the computer. It also has all herbs and essential oils and vaccines. We treat vaccine injury in children very frequently. And so we can test the vaccines, the DPT, the MRI, MMRI, and check these guys and see which ones have been weakening, and then we can make a homeopathic against it. And now heavy metals, patient may come in and say, I have a bunch of titanium in my mouth for implants. I'm wondering if I do okay with the titanium. And again, we can check it on the spot, as well as chemicals. How about Agent Orange, doctor? I was in Vietnam and I was exposed to Agent Orange. Does this still bother me? So you can check all chemicals. And then foods, well, how about gluten? How about casein? How about nuts and seeds? So you can check all these guys. All hormones are in there as well. And I check 6 different kinds of thyroid, and I have them all in little separate vials actually, but I check regular Armour thyroid and desiccated nature thyroid. And for people that are autoimmune, of course, we do T3 and T4 and MS thyroid, and also even synthroid. Some people like synthroid better, which is a drug in vaguely resembles thyroid. So, and also we can look at implants and vertebrae. Oh, I have this horrible pain. It's in my neck. Is one of these vertebrae weak, or is it my lumbar spine? We can check vertebral segments to see if they are weakening the patient. And and that can check breast implant material. And then radiation. Yes, I was raised in Fallon and just downwind of the atomic reactions, and you can check ionizing radiation and any radiations that we want. So this has a very extensive vocabulary of energies that can be checked against the patient. And I encourage everybody to let this assist you in your daily work with your patients. Oh, and by the by, computerized homeopathic and other electronic measurement devices are lawful in Nevada under the Nevada Administrative Code 638.015. Of course, we always use regular diagnostics as well. And this is legal for licensees under the Nevada State Board of Homeopathic Medical Examiners. So that's a wonderful service to be under the Nevada Board of Homeopathic Medical Examiners and have coverage to do this type of testing and regular homeopathy. Well, we speak about auto-intoxication a lot, and this has been around, as we like to say, on the bottom line there in Ayurveda, classical Indian medicine, for over 5,000 years have been speaking of this. And I like to tell a little vignette of a story of mine. Back in 1973, I was at Esalen Institute visiting a doctor friend of mine. And I don't know if you know Esalen, it's just right on the coast, goes right down into the ocean. And down below is the restaurant, and we were up above in the quarters, the living quarters area. And we were having some apple and cheese and crackers. And up walks this Indian Ayurvedic physician, Sham Bhatnagar. And he comes up and said, "Could I have a little bit of cheese and crackers, please?" I was down there by that restaurant, and oh, they're cooking that meat, and oh my God, the smell is so awful. You know, Hindu veggie. Said, "Sure, have a little cheese." "Well, listen, I'm Dr. Gerber, and I work at the Stanford Research Ward at the Palo Alto Veterans Administration Hospital, and we treat our schizophrenics with Thorazine and Stelazine, and maybe Haldol was around back then. How do you treat your schizophrenics in India?" I said, "Well, we don't have that many schizophrenics in India, but if somebody goes a little crazy, we give them several liters of saline." "Salt water? What does that do?" He says, "Oh, they defecate for several hours and feel much better. The apana, the downward flowing winds, become disturbed and go back up to the brain and cause craziness. Everybody in India knows that." And I was rather taken aback. Of course, I didn't know salt water caused diarrhea. But I went to the Lane Medical Library back at Stanford, and here were these auto-intoxications of schizophrenia. Skatols, pyrols, indoles had cognitive aspects to them. So the apana is one of the like prana, but it moves the circulation in the colon, intestines, urinary bladder, genital system, and the apana gets vitiated when they cause diseases. And if you look at Google under auto intoxication, it's roundly poo-pooed, and it's not even found at all in up to date. But it's synonymous with autotoxicosis, endogenic toxicosis, enterotoxication, intestinal intoxication, self-poisoning. So, and that's
not liking me today.
Pardon me? In any event, auto-intoxication has been around for hundreds and thousands of years. And one of the best ways of toxing up our system is, I think here, Phaseolopsis busci, the giant intestinal fluke. As we'll mention, it's endemic to much of the world, especially Southeast Asia, but it's found its way here. And I'll show you where it lives here in a minute. But it can cause irritable bowel syndrome, diarrhea, constipation, right upper quadrant pain, nausea, vomiting, gastroparesis, intestinal bloating, especially after meals, food sensitivity, weight loss, starvation, anorexia, bile duct obstruction. And there is a photomicrograph. This guy can actually get fairly large, up to 4 to 6 centimeters. And again, it's been found in 51 countries. Some endemic areas can reach 100% infection. It sources undercooked sea vegetables, fish, and pork, but especially any real rare meats can have it. And again, it's routinely missed in routine GI evaluations. Again, the common symptoms, IBS, right upper quadrant, bloating, nausea, vomiting, fatigue, but also brain fog and psychiatric disturbances, gastroparesis, weight loss, again, psychiatric symptoms in chronic disease. And there's the life cycle. It can hide out in various parts of the life cycle, in biofilms and in other parts of the body. So the fluke is something that I had not really thought about until the last few years. Now, to find it, you have to do, besides energetically, look at stools, do duodenal aspirates in the bile. There are PCR tests that are developed but not routine. CAT scan may show liver nodules or calcifications. Ultrasound may show leaf-like flukes, biliary stones, duct abnormalities, and possible bile duct blockages. Now, the fluke lives right around in here, in the small intestines, in the duodenum, right by the ampulla of Vater. And the bile duct comes right in here along with the pancreatic and the common duct. And bile is alkaline. And if we don't get enough alkalinity onto the food, then the pancreatic enzymes go, hey, this is not my union. I'm not going to digest this food. And so we get undigested food. So the carbohydrates ferment, blow up, make gas, and cause pain. And a lot of people think that the bowel only registers pain when it's stretched. You can burn it, you can cut it, and it doesn't recognize pain. But if you stretch it, it certainly can. Also, if you have a blown up transverse colon or intestine, and it's sitting right underneath the vagus nerve, coming out into the sternum. So instead of that vagus nerve being parasympathetic, it could go sympathetic, and tachycardia, shortness of breath, anxiety, and all of the sympathetic symptoms that can come from vagus nerve blockages. And the fats go rancid, cause inflammation, and the proteins can then putrefy and not digest. So all of this is feeding the microbiome. And it goes, oh, hip, hip, hooray, undigested food, just what we like. And it can make anything that it wants out of it. So you can make a lot of various odd chemicals that cause, intestinal stasis, as well as leaky gut syndrome. So the bad boy sits down in here, and I'll tell you, more stories about it here in just a minute. Well, back in 1991, I ran into this book, Cure for All Cancers by Hulda Clark. And I thought, how crazy. And the first thing that she mentions in there, and let me just read to you an acknowledgement in that book. And I would like to express my sincere gratitude to Dr. Frank Jerome, DDS, for the loan of his parasite slide collection. If he had not made a slide of Phaseolopsis musci in his student years, and if it had not stored his slides carefully for 3 decades, finally to loan them to me in generous offer, none of these discoveries would have been made. Most of these cancer patients could not have regained their health without his development and new metal-free dentistry. But she knew about this, and she has 100 cases of solved or cured cancer in there. But her major tenet is, you gotta kill the fluke. and this was, I don't know, 8 or 10 years ago, 7 years ago. This is a very stunning case, and I see this whole lady's family, but she was a 72-year-old lady, came in with a 25-year history of irritable bowel syndrome, bloating, vomiting, abdominal pain, with daily vomiting for 7 years. And she had been to every gastroenterologist, UC Davis, UC San Francisco, Stanford, Mayo, and she'd gone multiple endoscopies, biopsies, cultures, and imaging with no cause identified. So she was just suggested she was just delusional and dismissed as a psych patient and prescribed benzodiazepines and antidepressants. Well, we're going to come up to our favorite star of the show here, praziquantel. Remind me to give you the brand name after the CMEs. But she took a 1-day dose of praziquantel 3 times per day, 4 to 6 hours apart, with food. And the next day, she had complete resolution of all of her symptoms. And no more nausea and vomiting, no reoccurrence after 7 years. And the frequent ER visits for vomiting stopped permanently. Well, if that doesn't get your attention, wow, I can't believe it. So another nice case, a mysterious jaundice case. And we save all sorts of gallbladders doing this and all sorts of abdominal pain. But here's a 36-year-old male with a bilirubin of 11.6. And as we know, normal bili is under 1.1. And his GI guys had tested him for Hep A, B, C, autoimmune hepatitis, and they were all negative. There was no evidence of biliary obstruction. And about the next thing that was going on was to do maybe a pancreatic biopsy to rule out cancer. Big clue. He was an avid bow hunter, consumed wild boar and red meat. And I saw the rest of his family, and his wife sells and raised dogs. He had 59 dogs, cats, goats, sheep, horses, and then he would consume the wild boar meat and venison rare. And so again, we treated him with 1 day of praziquantel, and within 10 days, his bilirubin normalized to 1, and all of his jaundice totally receded. And the biopsy was canceled, and he had a full recovery. So again, that absolutely got my attention. So their fasciolopsis is identified, I think, in 1 out of every 2 or 3 IBS patients that I see. Again, the carbs promote gas and stretching of the bowel. It resembles gallbladder colic or left or right lower quadrant pain or hypogastric pain, and frequently pressing on the vagus nerve, which may promote cardiovascular and pulmonary symptoms. Undigested proteins putrefy and the fats go rancid. So it's frequently overlooked by gastroenterologists relying solely on standard labs and endoscopy. So you get dramatic resolutions often just after 1 day of praziquantel treatment. We frequently do a liver gallbladder flush after. But the dosage of the praziquantel is 25 milligrams per kilogram in 3 divided doses. And it is made here in Reno, especially in one of our compounding pharmacies. Now, natural alternatives. Dr. Hulda Clark would go with black walnut, cloves, and wormwood. And her black walnut tincture would require 2-3 times a day dosing for 3 months of consistent use. And as I say, I love herbs, but praziquantel does it in a day or 2 and offers obviously quicker results with much better patient compliance. So it's very difficult to diagnose this, but if somebody walks into your office with abdominal pain and right upper quadrant pain and a negative GI workup and ultrasound of say, well, you got a few little gallstones in there. It could be gallstones. And as we always say, that's, fodder for your surgeon. Well, we better take it out. We don't know. And fully 40 or 50% of gallbladder symptoms are the same before and after cholecystectomy, according to good research. So now, just to say that when we do this the praziquantel for the fluke, it's good to take a day off, and probably a good day not to drive. It can cause some nausea or dizziness or drowsiness or fatigue. Some people could get some abdominal pain or diarrhea, or some people even get PTSD. And for some people, it's not the most pleasant thing. But I give this to children, 2 and 3 year olds. Won't eat. If they eat, they vomit. Can't eat. And again, we can test this very readily with EAV. And again, we can put this into a tincture or into a solution and feed it into little kids one way or another in honey or applesauce. And again, so I think it's very, very safe even for young ones. But again, I test praziquantel against everybody before I give it to them. And some people energetically are not ready for it right off the bat. So we do more strengthening and work with, thyroid, which, like a lot of you guys, I think about half of all of our people need, and adrenal support and some nutrients, and then wait a couple of weeks and then see if it's ready to test again. But most people do very well with it for a day and are thrilled to get their digestion back. I always thought I just had the worst food allergies in the world. Now I can eat anything, doctor, and nothing bothers me. So it gets rid of a lot of food allergies and food sensitivities and the gastroparesis. It's just everything sits on my stomach, and gastroparesis can be gone in a few days. So if you have some suspicions that it could be a fluke, again, you can get praziquantel. You can have somebody give you some. You can muscle test it, but it's usually a 1-day treatment, and I think it's very, very worthwhile. All right. Speaking of flukes, here is Westergonomus, Westermanni, and this is a lung fluke. And a lot of times we find it from people who have a history of eating venison or sea vegetables. And again, it's acute and chronic lung disease after usual lung therapies are no longer effective. So chronic asthma, chronic COPD, and sometimes with lung lesions and granulomatous lesions in the lungs, and biopsied negative. So shortness of breath, wheezing, and actually I think I've turned around a couple of pulmonary hypertension patients doing this. Where does pulmonary hypertension come from? And nobody knows. So this is another praziquantel treatment, and it's a 2 or 3 day dosing. I usually try 2 days. And again, we have people back in 2 weeks, and I recheck the fluke, the intestinal fluke or the lung fluke, and see if it energetically is still weakening the person. And if it is, we do it again. But if it no longer is weakening them, we move on to some other fun infections, of which our patients have legion. And here's echinococcus, another fluke. And this can cause chronic refractory sinus infections. So once again, if they've been to the ENT and they've had surgeries and have been mold treatments, antibiotic treatments, allergy treatments, and nothing works anymore, it can be the echinococcus fluke. And again, it's a 1-day treatment. Now, babesia, and this is generally a co-infection of Lyme, and I think it's worse than Lyme. And again, a lot of fatigue, malaise, fever, sweats, myalgia, shortness of breath. And microscopy, you can see this guy under microscopy, PCR test for it, serology test for it. And you just have to have, a degree of suspicion. And it can be any insect bite. It doesn't have to just be a tick, any insect bite. And the treatment is azithromycin 250 BID twice a day for 10 days, along with atovaquone, which is an antiparasitical, 750 milligrams per 5 ml twice a day for 10 days with a fatty meal. And not always dairy, so olive oil or avocado. And again, it's usually not a very tough detox. And the atovaquone is a bright yellow, fluorescent yellow liquid that again can be got at several pharmacies here in Reno. You have to kind of groom the pharmacist. Otherwise, they'll say, I've never heard of atovaquone. And if you only want 100 ml for 10 days, but it comes in a 220 ml package. I'm not breaking down a 220 ml package into 100 ml. And it'll take me 3 weeks to get it. So it's sometimes a little difficult to find it. And grooming a pharmacist over time is a good idea. So Babesia microti. And I think the fatigue to it is, I think it's even worse. And malaise is even worse. And it accompanies a lot of shortness of breath to it. And again, you can diagnose this immediately on EAView computer. Schistosomiasis manzoni. And everybody says, isn't that a South American and African disease? And it is a fluke, but it's here. I like Klinghart's description. He says, we can find this in the most pristine lakes in Switzerland. And it comes especially in fresh water, especially kids that like to swim in lakes and ponds, or that are coming from a less pristine background and are drinking contaminated water. And it can go right across the skin. And again, you can see this under dark field microscopy as well. It likes to inhabit the urinary tract. So again, UTIs, blood and urine or stool. And I do think it can be involved in infertility as well. Also can cause hives, fevers, myalgia, and a dry cough. So usual blood test or dark field microscopy and blood test. But schisto is here. And again, another one of these unsuspected illnesses from fluke. And flukes are a big deal worldwide, and they are here. Another favorite is scabies. And the scabies come from the Latin scabrere, to scratch. And it's a lovely picture here. It's an 8-legged mite causing intense itching in hands, groin, and axilla. And it can be very chronic, but it can cause severe itching, red bumps, burrows, all sorts of skin lesions, various skin lesions, especially wrists and waist. The usual diagnosis is skin scraping and microscopy, but it's very underdiagnosed dermatitis. Just, you have food allergies. It's just just a regular dermatitis, but it can be extremely serious and can be very chronic. People go on with this for years. Especially we find it in people who have just cleaned out grandmother's house and have just moved around a bunch of old furniture or old carpets. They can find it in those types of places, so it can hide out. Now, the usual treatment is permethrin cream, 5%, is to his head to toe, scalp to the bottom of the feet, leave on 10 to 12 hours, and then usually let it dry, sleep, and then wash off, shower off. It can be done weekly, in bad cases, maybe twice a week. And again, you can get the permethrin at any pharmacy. And again, if you wanted to check permethrin energetically against your patients, you can. Ivermectin is another one. And for ladies, we usually give 12 milligrams, guys 15. And you can have this made at your compounding pharmacy. And usually twice a week is good orally. You can also make an ivermectin cream with it. You can make it also with B vitamins in it. Makes it a little less pricey. It is a bit pricey. There is a new anti-scabetic on the market called Spinosad, and that I've had sort of mixed results with. But there's an enzyme spray, which I'll give you the name of at the end here. But it's mixed enzymes, and it digests the calcium carapace off the scabies mite, and that can be sprayed directly on lesions, and it's supposed to keep the lesion kind of wet. It comes in a concentrate, and you can use a quarter cup of the concentrate that you get online very inexpensively, and add that to the laundry. So all clothing and bed clothing should be treated, as well. But again, this is frequently even missed by dermatologists, and this intense scraping and so intense scratching. So it's great to be very sensitive to the fact that it's going around. And if it's chronic, people deal with scabies for years and years, and it can be very debilitating. And sometimes actually a little cortisone cream on the lesions is not all bad. But scabies is a bad boy, and a lot of times you can feel it moving around under the skin. And when people tell you they're seeing things move around under the skin, sometimes it's scabies. And when people tell you they see worms in their stool or coming out their nose, believe them. These guys can go everywhere, especially they all have life cycles and can hide anywhere. So when people tell you they're seeing, especially we'll talk in a minute about worms. They're there. All right, roundworms, tapeworms, pinworms, whipworms. I think they're very common. Usually come from contaminated foods, household exposures, and of course, animals. Excuse me. Of course, diarrhea, bloating, abdominal pain, poor absorption, hepatobiliary symptoms, pancreatic, and pulmonary issues. Now, treatment frequently is over-the-counter Parentel pamoate. You can use this for kids with, itchy bottoms from the dog. And also albendazole, which is fairly available. Here there are various pharmacies that have it, and I usually use the 200 milligram twice a day for 10 days. There are some of these worms and pinworms that suggest just 2 or 3 days for 2 doses, and repeat in a week. The Cadillac of all these azoles is benzimidazole, and that can run $1,500, $2,000. But sometimes it's worth it with chronic parasitism, and sometimes you can find chronic worms and parasites, especially in ulcerative colitis and chronic Crohn's and other colitises, can be caused by tapes or roundworms, pinworms. I've been able to turn around a number of cases of chronic colitises by treating the roundworms, tapeworms. And people that have their dogs poop in the backyard and walk around barefoot, and start getting itchy bottom, pinworms. Oh, another favorite. Giardia, again, it's harder to diagnose, but again, a lot of times we see chronic diarrheas, and again, it can be, people, outdoors people, but it can come from any contaminated food or water. and certainly people that are drinking out of contaminated streams can be more at risk for this guy. And but it's severe diarrhea, and especially fatty stools, fatty, floaty, frothy stools, and especially after travel, a lot of times third world countries. And again, the treatment is azithromycin, Bactrim, or Flagyl, metronidazole. And again, when you're able to test these various antibiotics to see which agrees better, best with the patient, it's very handy, and it saves a lot of time of trial and error. And if, the azithromycin didn't work, we've got to go to the metronidazole. But it saves you a lot of trial and error time. And then you can diagnose Giardia, right on your computer if you wish. Oh, the big boy, Lyme disease, Borrelia burgdorferi. And, this may be a man-caused disease from the naval repository in the Connecticut River in the 70s, 80s. And it may have been a man-made disease, maybe, but to call it the great imitator of many diseases. And everybody knows about mast cell activation syndrome. Mast cells are white cells that contain a lot of histamine and inflammatory compounds. So this means that it can attack every organ system in the body: GI, GU, skin, CNS, respiratory. It can attack any part of the body. And so it's the great imitator. And a lot of people remember tick bites, but it can be also spider bites, deer flies, and even mosquitoes. Repeated mosquito bites sometimes can have Borrelia in them. So again, people come to us with chronic fatigue, chronic myalgia, chronic muscle pain, anxiety, depression, and they've tried everything and nothing works. And they've even had Lyme blood tests, which frequently can be false negatives or positives. So the ELISA and the Western blot 5 bands is not always that necessary to give a positive Lyme diagnosis. And again, a high index of suspicion is very important. So we see a lot of Lyme. And again, this is, everybody's looked at me and nobody can find a cause of why I'm so chronically ill, doctor. And it's frequently Lyme, sometimes mixed with Babesia. So there are many ways of treating it, and some people do Lyme for years, but we find just doing azithromycin 250 daily for 30 days is usually very helpful. And we usually add in the Cowden, Dr. Lee Cowden's protocol of Uncaria tomentosa, which is cat's claw, with Compsandra angustifolia, which is another antibacterial herb from Peru, and Desmodium molliculum. I'll give you the regular names they use for them here later, but that's a drainage remedy. Now we all know about die-off, and die-off, or the Herxheimer's reaction. And the doctors Jerish and Herxheimer's in the 1890s treated syphilis with intravenous mercury and intravenous arsenical compounds, and it worked very well, but the patients would frequently have very high fevers for several days and hallucinate and have seizures and lots of fun stuff. So that's everybody knows about herxing. So this, when you take these drops of the Cowden protocol, you start with a drop in 3 to 4 ounces 2-3 times a day, and increase by a drop a day till you get up to 15 drops 2 to 3 times a day, 12 days on, 2 days off. And if you start getting the die-off reactions, we drop the dosage of the drops back and then add the desmodium in half an eyedropper. And usually within 30-40 minutes, the die-off symptoms will alleviate and go away. So we usually get through Lyme in about a month. and sometimes it needs to be repeated, and sometimes they come back. But I think that is a very helpful protocol. H. pylori is another one that is tough to diagnose. The breath testing can be iffy. The blood testing can be iffy unless it's absolutely negative. If it's positive, it can be a recent, autoimmune IgA positive. But it can cause all sorts of GI symptoms, and especially chronic gastritis and ulcers. And the two docs that first found this in Australia in the 80s won the Nobel in, I think, 1991 for their discovery of this. And initially, the GI docs went crazy and said, no, it doesn't cause ulcers or irritable bowel, or also can cause autoimmune disease. And of course, in its worst phases, gastric cancer, but also I think rosacea and other autoimmune illnesses. Now, the standard treatment is the bismuth quadruple therapy with proton pump inhibitors and multiple antibiotics. And we have found a good treatment in our clinic using mastic gum, berberine hydrochloride, bismuth citrate, and zinc carnosine for about a month, twice a day, and usually get rid of all of the GI symptoms that are surrounding Helicobacter. H. pylori. Another unsuspected source of chronic fatigue is Epstein-Barr virus. And again, there are other viruses that go along with it, frequently adenovirus, the common cold and flu virus, coronavirus, one of the viruses that was made famous by our old buddy COVID-19, Coxsackie in kids that can affect the heart and heart arrhythmias, cytomegalovirus, echovirus, enterovirus, herpes virus, herpes 1, 2, and zoster shingles. So these are all common, but some people think about half the population is infected with Epstein-Barr. And so when people come in, doctor, I have no energy, I'm chronically fatigued. Everybody's worked me up and can't find anything. And that EBV actually does turn up positively on blood tests frequently. But again, how to treat it? So we treated with intravenous hydrogen peroxide, intravenous ozone, then intravenous vitamin C, 25 or 50 gram vitamin Cs. And we have inherited the knowledge of a homeopathic combination and of a 6C, 12C, 30C, 200C of all the above 10 viruses. And again, there's no viruses in it, made on the computer. It's just frequencies to stimulate the body's immune system. And we use 1/10 of a cc subcutaneously to spleen 6, which is an acupuncture point 4 finger breadths above the medial malleolus. And we alternate sides daily till improved. So we hand out 12 little insulin syringes. They turn up 1/10 of a cc and shoot that point. And frequently, within 2, 3, 4 days, the energy has changed a lot. And I use them all the time. If I get blasted by a patient with a virus and I notice my energy drop, I'll test my virus shots and do one, and usually within 20, 30 minutes, I feel better. So it's a great, has a great lineage to it. Comes from a number of homeopaths down the years in Reno. All right. Now, fungi and mycotoxins. Again, these are the other bugs that are harder to diagnose. And we love Dr. Andrew Campbell, who's appeared several times on this forum, who always reminds us that mold is the gun, mycotoxins are the bullets. And of course, his other statement is usually, there's no data for binders. So one of our early mentors in this business always recommended cholestyramine and and subsequently we've used the other binders. And but again, it takes a long time. And cholestyramine, have to take it away from food, and it's toxic to some people. And you try to get it so that it's organic. But we have found much better results with the azoles, which is what Dr. Campbell suggests. And so we check for Aspergillus, black mold, candida, and everybody with a sweet tooth. By the way, the sweet tooth homeopathic is Argentum nitricum, 6E, 12C, 30C, and we could really help people out with their sweet cravings. Penicillium notatum, Stachybotrys, the giant black mold, Coccidioides immitis, valley fever, and we find lots of valley fever in persistent lung illnesses. It's common in the Central Valley, but it's also very common in Arizona, Phoenix area, and I think it's not uncommon in the Reno area as well. I have a chronic gal with chronic lung disease, and she, and I think she grew up in the Central Valley, and she went to her pulmonologist, and he looked at her lungs and inspection and says, "There's soil in here, and there's something growing on it." But he didn't treat her for valley. Thought that was pretty awful. So the IgG serum is not always revealing, but again, you can check on your computer about Coccidioides immitis. And again, this requires usually 2 to 6 months of therapy using azoles. And I'm more a fan of itraconazole, and it's 100 milligrams twice a day for many of these moles. And fluconazole is effective if patients don't test well for itraconazole, but fluconazole is a fluorine substance, and we don't love fluorine substances as much. So this is another thing. Everybody's missing the fungus and the mycotoxins. So all these guys are unsuspected illnesses that frequently go undiagnosed and untreated. So, ladies and gentlemen, I hope this inspires you to explore hidden infections in both acute and chronic illness. And I always remember the Socrates saying, "Life is short, but the art is long." And I'm sure he was referring to the art of medicine. So we all have to thank our mentors and teachers for teaching all of this great information. And again, to thank Dr. Clearfield for this outstanding forum. And again, I'll give you my contact information when we are through with the educational portion of the talk here. So take it away, Dr. Clearfield.
Thank you, sir. That was great. The question: can EAV diagnosis be done virtually by sending you a hair sample?
Yes, probably.
Okay. Okay.
And the other thing that's kind of off the wall, but for babies, I just have the babies sit in the mother or daddy's lap and test mom or dad, and it seems to really work well for me over the last 20 years. And then when the kids get to be 4 or 5, they can easily stand pressure on their fingers of the device.
Okay. Praziquantel is an antihelminth medication commonly used to treat parasitic infections. I actually looked it up while you were talking. You can get it like at the vet store, sort of like ivermectin.
I haven't done it, but I think that's true.
Like I said,
I guess when we get through with the testing or your medical part of this, I can give you the name of the places that we use here in town if you'd like.
We'll get it in a few minutes. Okay. What is your opinion of the F-scan device to detect pathogens?
I haven't used it.
Okay. And can you use colloidal silver for fungal infections orally or topically?
Absolutely, and inhaled. No, absolutely, yes.
Okay. And Dr. Neri, you got anything online?
I have a quick question, Dr. Clearfield.
Yes.
Dr. Gerber, this is great. In the paragonymous infection of the lungs, do you check the eosinophilia to see if they have peripheral eosinophilia in their blood?
Not always, occasionally, but not always.
Yeah, because we're treating a lot of lung diseases, asthma, eosinophilic asthma. We're giving them all the big guns like biologics. I mean, I was wondering, I have always wondered if those eosinophilic asthma are due to some parasites in the lungs. We know that strongyloides, for instance, affects the lungs, and sometimes that can lead to some asthma flare, but we never really check those parasites, like you're saying, and we don't treat them as such. We keep on giving them big guns, and instead of giving them simple things that can cure them.
Yeah, the paragonymous, the lung flu.
Yeah.
I was just been reading the A Midwestern Doctor stuff on Mercola and on Substack, and he's been recommending DMSO for everything, and we use it, with cancer patients and as anti-inflammatory and as a method to transport stuff through the skin. But he's recommending, and I've just started to try it, and I can't be very strongly positive about it, but DMSO also in inhaling diluted with water as an anti-inflammatory for COPD and chronic asthma. DMSO?
Yeah, I do.
Dimethyl sulfoxide.
Yeah, I know that.
So he's been recommending that in people's inhalers.
Interesting. Okay, very good.
Hey, Dr. Gerber, I just wanted to make a reminder that Dr. Tano just wrote a book on DMSO, perhaps other drivers.
Oh gosh.
Yeah, can we announce that at least that you're working on that, Dr. Tano?
Yeah. Yeah, of course. Yeah, no problem.
Yeah, because it's really the book is way ahead of the game, but it deals with DMSO as a driver to apply homeopathics to acupuncture points. So you combine acupuncture with the homeopathic, and you do that through the DMSO through a micro drop, very small drop on the point. And it's very efficient, very cheap, and it works well and quick.
Wow.
Anyway, Dr. Tano has been leading that, and Dr. James, and Dr. Quinn is the head of the research committee that's kind of overseeing all this. And are you going to be able to make it to our meeting in December in Reno? Dr. Gerber?
Oh, I am in Reno, and I'm president of the Nevada Homeopathic Integrative Medical Association. So we should be putting up a third of the speakers.
Oh my God. Thank you.
At least.
Wonderful. Wonderful.
And then we get Dr. Tano to do another third, right? So we're just another day ending in a Y for him. So okay. What else do we have here? Preferred stool test for parasites.
It's the parasitology lab. It's in Mexico. It's run by an old Egyptian friend of ours. And I'm lax in not getting the exact name of the lab, but it's
okay. All right. Well,
parasitology lab.
Okay, when we're done the didactic portion here.
We're done didacticing.
We're didactic. You're the didactor at the moment. One doctor treats Epstein-Barr virus with Argentin 23 IV. So that's silver, right? Colloidal silver.
I have not done much IV silver. I think I should.
Yeah,
it's
one
not colloidal.
one patient told me she got treated with Argentine IV. The doctor gave to her IV Argentine, and it treated her.
Okay.
And I
Yeah, we
remember
use IV absinthium from Germany. Or one of my colleagues uses it especially for cancer.
Argentine. Yeah, I mean, somebody told me at the vitamin shoppe when I was in upstate New York that colloidal silver is good for cancer too.
Yeah, you don't give colloidal IV. Argentin is silver hydrosol. It's dissolved silver, 23 parts per million. Never give colloidal IV.
Oh yeah, yeah. She just had colloidal, but she said that the colloidal you can take it, it can help with the cancer too. But oral, she was referring to oral. But yeah, I know when I was to a conference with Ozone, there was a man that had colloidal silver, Argentine, and sugar and copper, and he was saying that we can give IV, and it's good for MRSA too.
You can do IV Argentin. We did the pioneering study in that about over 10 years ago, and used to give IV silver for a lot of different things. But it was, again, it's silver hydrosol. Don't mess with colloidal. Colloid is particles dissolved, and you don't want that.
Okay. And they said it helps also with MS, but I'm not sure which one. I think it was the colloidal silver or the copper. We still don't know so much about these two products. I mean, that could be one conference one time.
There's a question, Michael, about can you give DMSO inhalation for lung cancers?
I've not tried it. I've just been aware of that for a couple of months, and I've just heard about it for COPD and asthma. But it makes sense. I know it's given in Dr. Devlin here does add it to some of his IVs to treat cancer patients as an adjuvant.
How do you treat echinococcus again?
Same thing. The prosaquantal. Oh, we're off. So it's Biltricide is the brand name.
What is your dilution ratio for DMSO inhalation?
Again, I'm just reading a Midwestern doctor, but they start 70-30 water DMSO and then 50-50 daily for a week and then twice a week. I'm just getting people started on it, so I haven't had much feedback on it yet.
Okay.
But I do like DMSO IV for chronic inflammation. 5 cc's, 99%, compounded DMSO for inflammation. All total body pain and inflammation has been quite helpful.
Okay. Dr. Chandler, a resident biological dentist, states that okay, this is a brand name. I'll hold off on that until we're off. So I'll read it. I'll read it a little bit later. Dr. Nario, got any email questions?
Yes. So, Dr. Gerber, thank you for that great presentation. One of the questions would be, of course, there are integrative stool tests out there, integrative medicine that we are very familiar with. Is that something that you're using, or are you just using the regular lab for Quest stool testing?
I just use EAV.
Oh, no, not even a stool test, basically.
Rarely. If we need to, prove a point, we can try it. But again, once you treat somebody, the stool test is now negative, So, and people would walk in with, screaming diarrhea and abdominal pain and right up quadrant pain, nausea and vomiting. are not likely to like to wait for 2-3 weeks to get a stool testing result back before you treat them.
Right. And as the yielding of the LabCorp Quest for this regular ova stool and parasites is very low, because I have seen tests that turns out to be positive in the integrative testing panel versus just the regular ones that we use in the lab. So, and again, EAV is another method definitely that is great to be used in this aspect. So when you mentioned about these parasites, there's a question here because we have people from Southeast Asia. Are you seeing more of these cases in relation to travel, or by being in the US alone, would that already be a risk factor for them to have these parasites? We all know that the US is not a third world country. What have you been seeing in your case base?
Absolutely both, especially military folks that have served in Southeast Asia seem to be bringing it back, or people that have just traveled a lot to Southeast Asia and been to India, Nepal, and China, uh, and bring back upset tummies. See that a lot, but for some reason, many of these guys have found their way here, and I think the roundworms, and tapeworms have been here forever, and the animal worms, and the pork worms, trichinella, all these guys have been around forever. So I think probably nothing new under the sun. We're just starting to look more for it. But and the IBS, the irritable bowel syndrome, people seem to have become much more frequent appearance in our clinic.
Right. And as you all know, IBS is kind of a waste basket diagnosis thrown out GI docs out there because they don't know what it is. And from the sound of it, there's definitely a basis for this in your approach. And again, as you can see, parasites does not discriminate anymore. Doesn't have, it doesn't require you to be in a specific country. That's why history of travel definitely is one of the bigger parts of our history taking. We definitely need to kind of get in there. So a curiosity about your use about praziquantel and atovaquone. Do you check any specific labs for that, or any specific adverse effects that you're noting to see in your patients that our clinicians should be watchful about?
Well, we also like to do, we're refining our liver gallbladder flush. And instead of using Epsom salts, we're going back to using magnesium citrate, which is more gentle. But no, people can get tired and spacey. Don't drive until you check out your driving chops, your driving ability. And again, spacey, tired, maybe nauseous, maybe diarrhea, but fatigue is not uncommon. So this first day, there could be a fair die-off. And that's why we like to do a short one-day liver gallbladder flush afterwards for many people.
Oh, nice. So that's after the round.
Yes, after the praziquantel.
Oh, wow. Okay, that's amazing. And all of these are just oral, right? It's not like maybe.
Yep.
Okay, wow, that's awesome. Well, you got my list out, Dr. Gerber, and I hope we could see you in the conference. This is amazing stuff, and hopefully you can deliver this also live in person in our upcoming conference on December.
Okay. All right, I'm happy to do this again if you like. And it's just, homeopathy in general, it's a science and an art, and people don't get enough exposure to the art of it. And and then just reading people. My other big issue is touching the patient, and I think everybody should take pulse. And we learned Chinese pulse course in acupuncture training, but you can check an adrenal pulse, which is the third pulse up on the left hand deep, and that's the kidney adrenal pulse, and the thyroid pulse is triple warmer, which is the third pulse superficial on the right hand. And again, many people don't have a radial pulse at all. They're so hypometabolic, you can't even feel a heartbeat at the wrist. So this tells you an awful lot about people right off the bat. And I encourage everybody, touch your patient.
Okay. Dr. Quinn mentions research on Argentin by Dr. Eric Rentz.
And yeah, I've seen a ton of research on this. I'm not sure where Dr. Chandler found out there wasn't any research. I've had it in my hands.
Okay. And then the next question, what do you use for your liver gallbladder flush in addition to magnesium citrate?
Olive oil with the juice of a grapefruit. And we like to usually put lemon in the Epsom salts, but lemon probably. But the juice of a grapefruit with the, so we do 4, 6, 8, the magnesium, 945 olive oil with the grapefruit juice, a grapefruit juiced. Then next day, 6 a.m., 8 a.m., magnesium, and that's it. And then watch out for the diarrhea. Look for the little green stones. Look for parasites. Look for odd stuff coming out. I usually tell people to get a very strong flashlight and look at the stool, because you can see fun little green stuff and yellow stuff floating around.
Mm-hmm.
Dr. Bill, that's your detective game for December.
There we go. Okay.
Right.
All right. You can have a workshop on that, Dr. Gerber.
Well, the fun thing is, I don't know about you guys, but patients bring me in mason jars full of, this has got to be a parasite, and I just don't get up my guts to go slice them up and look at them under the microscope, but probably should. But people say, oh, I found I saw a 2-foot worm come out of me, and probably tape. But people talk about worms all the time, and when we do the cleanse and the detox, worms frequently come out. I see a number of CIA guys down in the San Diego area who've worked in South America, Africa, Central America, Southeast Asia, and they have awful filariasis, which is the little worm that lives in the lymph, and they can see them crawling around the lymph. And they like to take ivermectin and other anti-parasiticals 2 days before and 2 days after every full moon and new moon, just to try to keep them down. So they have a chronic battle going on.
That was one question I was going to ask you. Do you combine praziquantel and ivermectin ever?
I haven't, but it's probably not a bad idea.
Yeah, I think it would be a good idea to eradicate some of these parasites.
Great. What dose would you think?
Well, I haven't thought of any dosing, but I think it could be a good idea. Even if you do mebendazole or the expensive one that you showed in combination with ivermectin, it may do a good job compared to one alone.
Thanks for that.
Yep.
Dr. Gerber, you mentioned about this. I've been hearing about this, the full moon, non-full moon. How does this affect parasitic activity?
I don't know if there's any science behind this, but people that have been fighting parasites say they move on the full moon.
Like psych patients, huh?
And for Babesia,
these are well-respected people who've been fighting their gut bugs for decades, a lot of them.
Interesting.
So for the Babesia, instead of using just atovaquone, would you also use the Malaron, which is a combination of atovaquone and another drug with the azithromycin?
I do use the atovaquone and azithromycin, especially for Babesia. Yeah.
Yeah, I think Malaron would work equally good if you do that with the azithromycin.
Okay.
Malaron, which is an anti-malarial,
Yes,
but it
sir.
works really great, I think.
Thank you.
Yeah.
I don't know what that was. For lymphedema, you see a lot of parasites.
Hello?
Is that a question for me?
Yeah.
Oh, yeah. I saw
I'm
some
sorry, I
patients,
missed it. Can
they
you?
suddenly get the lymphedema, suddenly, overnight. So I was wondering what is the underlying cause for that?
What happens overnight?
They get lymphedema. They are fine, and then suddenly they get lymphedema.
You know,
I mean, I'm not
I
sure
don't know.
of
It could be any
but they
infection. Any infection can be teeth. Teeth cause lymphadenopathy and lungs, groin, all over the place. So it could, any infection could cause it.
I know a young girl who was below 30, and she had normal legs, and then all of a sudden her legs start swelling like lymphedema. And I was
I think
wondering,
Petronella, there's a condition called filariasis. So this is something I've seen in the tropical countries.
oh
And
yeah,
this actually produces lymphedema, especially like in the lower extremities. And you use, it's rare, they don't use this much here, the ethyl carbamazine, I think. But you can also use doxycycline and albendazole. So it's one of the, yeah, there you go, elephantiasis. So that's I guess that's where I've heard lymphedema related to a parasitic infection.
Yeah,
I know,
so
but I was wondering if it can be caused by other parasites, like not the tropical, not the classic one, elephantiasis, because that is extreme. But this one, it's still very uncomfortable because they cannot even wear a skirt. They have to wear pants. I mean, the legs get swollen.
Are there GI? Does she have GI symptoms too? Abdominal pain, bloating, gas?
No, she did not relate it, and she looked otherwise normal. I just didn't
How
know.
old is she? How old is she?
Maybe 26, 27.
Oh, and where does she hail from? Where does she live?
In Florida. She's a nurse practitioner, and she came to train me for something, and then she told me, and I was thinking, what can it cause? What could cause this? I don't know.
There are certainly a lot of toxins in the surf bacteria in the ocean that can cause many lymphatic symptoms and a lot of toxicity. So maybe she's a swimmer in the ocean.
Oh, I am a swimmer in the ocean. No, I don't know about her, but she might be. Yeah, she could be. Well, I go to ocean every weekend, so it's not good.
Okay. What about mebendazole?
I think it's very good. Again, it's a little harder to come by. Again, maybe you can get it in pet stores. It's a little harder to come by and maybe a little more expensive. And albendazole is pretty generic.
Actually, in the tropical country, I mean, like poor developing country, they all have mebendazole. Here in the U.S., it's kind of difficult to get the mebendazole. I don't know why. It was available for a while, but I think they canceled the prescription or something, so it's not available as easily.
Dr. Gerber, you're getting an invite to go to the Philippines. There's a lot of parasites there, according to Carol.
Ready to go.
Yeah, they'll give you a plane ticket.
I think Dr. William Marquis, he talks about cancer and mebendazole, and I think he sells it even by pounds. He sends like a powder. He's an oncologist from Canada. He has a Substack. I do not know how good it is or if it's the quality.
Oh, Dr. Gerber, you can share your source now because I think we're off, right? Dr. Clearfield?
We are